Hello, my name is Leslie Soever. I'm an advanced practice physiotherapist working at University Health Network in Toronto. I have a special interest in musculoskeletal disease, which includes many types of arthritis. I am particularly excited for the physiotherapy profession, as we have much to offer to improve the function and quality of lives of people with arthritis. This module is about exercise and arthritis. The objectives of this module are to describe how arthritis impacts physical activity, the benefits of exercise for individuals with arthritis, the role of physical therapists in promoting physical activity and exercise among individuals with arthritis, and current best practices in exercise guidelines for individuals with arthritis. There are many types of arthritis. For the purpose of this module, we will focus on osteoarthritis, the most common type. What is osteoarthritis? Looking at the Latin derivative of the word, osteo refers to bone, arth to joint, and itis to inflammation. Simply, osteoarthritis results in damage to the joints and surrounding tissues. The Osteoarthritis Research Society International, otherwise known as ORSI, proposes the following formal definition of osteoarthritis. Osteoarthritis is a disorder involving movable joints characterized by cell stress and extracellular matrix degradation initiated by micro and macro injury that activates maladaptive repair responses, including pro-inflammatory pathways of innate immunity. The disease manifests first as a molecular derangement, abnormal joint tissue metabolism, followed by anatomic and/or physiologic derangements characterized by cartilage degradation, bone remodeling, osteophyte formation, joint inflammation, and loss of normal function. All this can culminate in illness. In order to understand osteoarthritis, it is important to have a basic understanding of the components of a joint. Cartilage covers the ends of bones. Its main purpose is to provide shock absorption. The joint capsule is a fibrous sac that encloses the joint. The synovial membrane is a tissue that lines the joint capsule and produces synovial fluid. Synovial fluid is the lubricant for the joint. Ligaments are relatively strong tissues that connect bones to bones and provide stability to joints. Common joints that are affected by osteoarthritis include knees, hips, thumbs, and fingers. With osteoarthritis of the knee, often there is a visible malalignment of the knee or bowing out called a varus deformity. In addition, the knee may be swollen or thicker in appearance. One way of determining the severity of osteoarthritis is by radiography. On X-ray, typically osteoarthritis is defined by 4 cardinal features, including narrowing of the joint space, roughening or sclerosis of the joint surface, bony cysts, and extra ossification of bone called osteophytes. All of these features are depicted in the X-ray on your right. Symptoms commonly reported by people with osteoarthritis include pain, stiffness, swelling, fatigue, and loss of function. Generally, pain is worse with activity with osteoarthritis. Stiffness usually occurs with maintaining the affected joint in one position for too long. Swelling can be made worse by excessive activity. Causes of fatigue are multifactorial. However, pain is a known contributor to fatigue. With all these symptoms, patients often report loss of function, both in their recreational and occupational activities. Signs are what healthcare providers observe or measure when assessing the severity of osteoarthritis. We assess for swelling, deformity, muscle atrophy or loss of muscle bulk, tenderness to palpation or touch, temperature, movement of the joint, stability of the joint, muscle strength, ability to walk, and do other functional tasks such as kneel, sit, grip objects, and so on, depending on the joint under assessment. There is evidence from the literature that exercise decreases pain, decreases use of pain medication, decreases physician visits, and increases physical function in patients with osteoarthritis. In addition, exercise increases muscle strength, increases coordination, decreases fatigue, and decreases stiffness in people with osteoarthritis. It has also been found that group aquatic exercise increases long-term adherence due to social bonding and friendships. The College of Physiotherapists of Ontario proposes that physiotherapy is the treatment to restore, maintain mobility, function, and well-being. Specifically related to osteoarthritis, physical therapists or physiotherapists are trained to provide comprehensive musculoskeletal assessment, provide non-pharmacologic suggestions for management of symptoms such as pain, prescribe individualized exercise programs, progress exercise programs, and provide education on such things as pacing of activities, how to protect joints, manage symptoms, modify sports, and occupational activities. I would encourage you to think of exercise as a form of medicine for osteoarthritis. Just as when medications are prescribed with a type, dose, and frequency, so are exercises. This concept is well described in the article published in the Scandinavian Journal of Medicine and Science in Sports, December 2015, written by Pedersen and Salton. There are many types of exercise, including range of motion, flexibility, stretching, strengthening, and exercises in water, hydrotherapy. Sports, of course, provide exercise and can be varying in type with respect to contact versus non-contact, low impact versus high impact. As one improves and progresses with exercise for their osteoarthritis, there are ways to increase difficulty. Generally, non-weight bearing, gravity eliminated positions are the easiest positions with which to begin. Believe it or not, moving a limb against the force of gravity provides a form of resistance. Eliminating gravity makes things easier. Weight-bearing positions provide a more functional approach for the lower extremity and incorporate neuromuscular principles that have been shown to be effective by the GLAD program, which I will talk about later. When choosing the prescription for exercise, that is the type, dose, and frequency, physiotherapists consider a number of things, including stiffness, pain, inflammation, fatigue, soft tissue involvement, joint involvement, other diseases, and medications. For example, those with cardiovascular disease may need to limit repetitions and amount of resistance. Certain medications may make one more prone to bleeding, in which case contact sports may not be recommended. In addition, demands of work, leisure activities, and current level of physical fitness are also important factors to consider when prescribing exercise, as is access to locations to carry out the recommended activities. In the next few slides, I would like to highlight recommendations made by some international organizations related to exercise and arthritis. ORSI recommends, for all patients with osteoarthritis of the knee, land-based exercise, weight management, strength training exercises to increase leg muscle strength, water-based exercise such as swimming or water aerobics, and self-management and education. The European League Against Rheumatism recommends a combination of strengthening, aerobic, range of motion, and stretching exercises for people with hip and knee osteoarthritis. The National Health Service in the United Kingdom posts the following on their website related to exercise and arthritis. If your arthritis is painful, you may not feel like exercising. However, being active can help reduce and prevent pain. Regular exercise can also improve your range of movement and joint mobility, increase muscle strength, reduce stiffness, boost your energy. As long as you do the right type and level of exercise for your condition, your arthritis won't get any worse. Combined with a healthy, balanced diet, regular exercise will help you lose weight and place less strain on your joints. The Arthritis Society in Canada compares the right mix of exercises to the right mix of foods in one's diet. They recommend a mix of flexibility, strengthening, and endurance exercises for those with osteoarthritis. The American College of Rheumatology puts forth specific guidelines for hand, knee, and hip osteoarthritis. And as you can see from the details on this slide, they prescribe exercises for patients with hip and knee, and these include various types of exercises. The GLAD program, developed in Denmark based on scientific evidence, has recently been implemented in Canada. On their website, they promote exercise, stating exercise has been shown to be the best treatment for people who have trouble with their osteoarthritis. Specifically, the GLAD program focuses on neuromuscular exercise, which addresses the quality of movement of a joint and emphasizes control of the specific joint under question while maintaining postural control at the same time. This concludes this module. Exercise is medicine for arthritis, as illustrated by the stance taken by various international authorities based on scientific evidence from the literature. For some of the evidence, please refer to the